Today's quality measure is chlamydia screening. As an overview, the denominator includes women 16 to 24 years of age identified as sexually active. For the numerator, it is women 16 to 24 years of age identified as sexually active with at least one test for chlamydia during the measurement year. Payers include commercial and Medicaid, and for the 2024 measurement period, it is January 1st, 2024 to December 31st, 2024. Patients are identified as sexually active through claim or encounter data and/or pharmacy data. There has been a HEDIS 2024 update. They've added a laboratory claim exclusion to value sets, for which laboratory claims should not be used to determine sexual activity. It excludes patients who had hospice or palliative care services or are deceased, women during the measurement year who had a pregnancy test and, within 7 days, were either prescribed isotretinoin or had an X-ray. All of the following are required for documentation: a note in the medical record indicating the date, month/year, and the findings or results of the chlamydia screening. Results can include terms like negative or positive. Screening options. Labs include vaginal swab and urine testing, infected area swab, or a pelvic exam. Cervical screenings do not include STD tests. Patients must ask during a routine smear test. Patients can self-collect but cannot self-report labs. Here's an example of a patient's lab report. It has all of the following of type clearly listed as chlamydia, the results as negative, and the date of service. Common insufficiencies. Chlamydia screenings may not be captured via claims if the service is performed and billed under prenatal and postpartum global billing. It is important to include a copy of the lab results in the EMR. Cervical screening pelvic exams or pap smears do not automatically include STD testing. Use of the word chlamydia testing or screening must be used. The appropriate labs are included, or the claims data is submitted. There's no exception for patient refusal. Relevant codes that a primary care provider is the direct biller are listed below. Submission of these codes will close the quality gap through claims with the payer, especially when medical record review is unavailable. Let's review strategies for compliance. Upload lab reports into your EMR and label clearly for easy identification. Ensure workflows are in place to notify and remind providers of when a patient's next screening is due. Make follow-up phone calls if patients have not completed their screening. Educate patients on the risks of undetected chlamydia and screening options. Refer patients to ACN Care Coordination for additional support. Continue working with your clinical performance consultant and use ACN's additional resources. Visit Arizona Care Network's website for updated 2024 tip sheets and additional quality measures. This concludes the chlamydia screening training course. Thank you for listening.